This is Joseph. His mind is constantly racing, and it's racing with negative thoughts. He worries about everything, from saying the wrong thing to a friend, to wondering if he will lose his cell phone, to questioning if he is eating healthily enough. He also thinks about the bigger problems, like if his daughter is safe at school or how to make sure that she has a good future. These may seem like typical worries that everyone has, but for Joseph, they consume his life, and he is in constant anxiety and fear. Caroline also worries quite frequently. She is in a high-stress job that demands a lot of her time. She is also a parent. The worry and stress are natural, but sometimes she becomes overwhelmed and breaks down, becoming ill for a short period of time. Joseph and Caroline both decide it is high time to go and see a doctor. They want to better understand and help put an end to these unwanted feelings. The doctor tells Joseph he has been diagnosed with general anxiety disorder, also known as GAD, while Caroline was diagnosed with panic disorder. Before the diagnosis, they never knew the difference between the two. GAD and panic disorder are both anxiety disorders with unique differences. GAD is a mental condition that is characterized by excessive and uncontrollable worry about everyday life events and the future. Panic disorder is characterized by panic attacks that can occur for seemingly no reason at all. They both can also happen during or directly after a traumatic event. There is not one single cause for GAD. It is believed to be caused by a complex interaction of genetics, brain chemistry, personality factors, and the environment in which the afflicted were raised. Traumatic experiences and stressful life events can also trigger a person to develop GAD. The symptoms for GAD are as follows: constant high levels of worry about everyday things or things that do not normally warrant anxiety. Inability to let go of your worries even if you know they are irrational or unrealistic. Feeling restless, irritable, or on edge. Problems concentrating. Problems with sleep, either difficulty getting enough sleep or sleeping too much. Being easily frightened or startled. People with GAD may also experience the following physical symptoms: high levels of tension in your muscles, regular headaches and nausea, low levels of energy or constant fatigue, increased sweating, trembling or heart rate. Panic disorder is defined as having recurring and regular panic attacks, often without any apparent cause. Panic attacks bring about a sudden rush of intense fear and panic, whereas general anxiety disorder is a slowly increasing and constant feeling of apprehension and unease about both the present and the future. Signs of a panic attack are intense feelings of panic and stress, trembling and shaking, sweating, increased heart rate, difficulty breathing, numbness or tingling in hands and feet, feeling dizzy or lightheaded, chest pain, feeling unreal or detached from yourself. Due to the terrifying nature of a panic attack and the feelings of pain in the chest area, many people experiencing them for the first time think they are having a heart attack or that their life is in danger. An attack can last from a few minutes to an hour, and after it's over, some people recover quickly and never experience another. Others may start to have them more regularly, and the experience can be so frightening that they constantly worry about when the next one will occur. The symptoms of general anxiety disorder and panic disorder can successfully be reduced or controlled using medication. For GAD, therapy and counseling can be helpful in becoming aware when your worries are unrealistic or exaggerated, along with instilling positive thoughts instead of negative ones. For panic disorder, medication and therapy can help manage symptoms so that you can calm yourself down when you feel an attack is coming on. Anxiety disorders can affect anyone, no matter how strong or successful. Getting treatment for anxiety does not mean admitting weakness, but means choosing to live life on your own terms without letting those worries hold you back. If you know someone who struggles with anxiety, telling them to stop worrying or to get over it will not help. Oftentimes, they know that they are overreacting and behaving irrationally. However, the fear, panic, and feelings of anxiety are still very real. Don't judge, and let them know that you are there to support them without adding any additional pressure. Simply spending time with them and showing that you value them despite their anxiety will have a bigger effect than you can imagine.
What do you think it's like to always live in fear? Fear of thinking, fear of what will happen to you in the next moments. Most of the viewers would think of this as an unknown gesture, but some people experience this. They live in a world much darker than our own and experience a disorder. This disorder engulfs not just a few people, but hundreds of millions of people. This ailment is called general anxiety disorder and panic disorder. Hello, and welcome to our channel, where we explore the mysteries of mental health and grow with our audience to understand them. Today, we're delving into the conditions of general anxiety disorder, GAD, and panic disorder. There is always a chance that you might not realize if a person has this, so with this video, you will be able to help yourself or someone you care about to recognize the signs and symptoms of these disorders. First, let's talk about general anxiety disorder, often called GAD. It is the most common type of anxiety disorder. Around 4% of the total world population, that is almost 374 million people, are suffering from this condition. This affliction is mostly found in populations in their early 30s. It can make everyday life feel torturous. The relentless worry and extreme tension just make life more difficult. So, to know if a person is suffering from GAD, let's take a closer look at the symptoms. But remember, if you're experiencing these symptoms, you're not alone. Living with general anxiety disorder means that you can't have peace of mind. A person keeps overthinking about matters that may be real, or sometimes they're not even real. They tend to conclude negative outcomes and get depressed by them. People with general anxiety disorder show a constant state of restlessness. They can't sit still, and you may notice them fidgeting even when they're not interacting with anyone. Fatigue is also a common symptom of anxiety, because when a person is dealing with anxiety, there is a hormonal rush that can leave them feeling drained and tired. The crash is probably temporary, but the feeling of exhaustion can last even after they have gotten some rest. GAD can make it challenging to focus on tasks, which makes everyday life more challenging, and it often feels like their mind is playing tricks on them. Physical distress, like muscle tension, headaches, and physical discomfort, are also signs of anxiety. Understandably, GAD can make the affected people easily irritable or on edge, and sometimes sleep might become a rare luxury, with difficulty falling asleep or staying asleep being common issues. Now it's time to discuss the second condition called panic disorder. It is characterized by frequent and repeated panic attacks. These attacks are characterized by a sudden wave of fear or discomfort, or a sense of losing control, even when there is no danger or trigger. Panic attacks are generally reported in teens or early adulthood. A person who experiences panic attacks constantly lives in fear of when the next attack may get triggered. This makes their life extremely uncomfortable and terrifying. Rapid heartbeat is the most common symptom of panic attacks. This state of panic attack is the most frightening, as they feel like their life is not in their control, and the feeling of helplessness makes it all the more terrifying. Shortness of breath is a major symptom. It occurs due to the fight or flight response. When it kicks in, blood pumping increases, making the muscles ready for action. This results in shortness of breath. Sweating, trembling, shaking, nausea, and upset stomach are often experienced during a panic attack. This makes the person extremely uncomfortable and self-conscious. Almost 22% to over 70% of panic attacks are associated with chest pain. Most of the patients mistake it for a heart attack because of how intense it is. During a panic attack, the chest feels sharp and stabbed in the middle of the chest, hence giving the painful feeling of a heart attack. Feeling lightheaded or even fainting can occur during a panic attack. Chills and hot flashes cause sudden temperature changes, which can make the experience even more unsettling. Both GAD and panic disorder involve anxiety, but their symptoms differ. GAD is characterized by overthinking, worry, and physical tension, while panic disorder involves intense, acute episodes of panic attacks. But this does not mean that they both are incurable. Some remedies can help the person and their loved ones to get in control of this disorder. If you or someone you know suspects GAD or panic disorder, consult a mental health professional for diagnosis and guidance because they are the only people who can confirm if the person is experiencing this disorder. Cognitive behavioral therapy, CBT, is incredibly effective. It helps individuals to get control of their lives by identifying and managing anxiety triggers and symptoms. Sometimes, medication may be prescribed to manage symptoms, especially in severe cases when therapy alone isn't sufficient. Also, prioritizing a healthy lifestyle with regular exercise, a balanced diet, and adequate sleep can significantly improve anxiety symptoms. Techniques like deep breathing, mindfulness, and meditation can help reduce anxiety and prevent panic attacks. Friends and family are essential in the journey to treat GAD and panic disorder. Please be patient with them, offer reassurance, and lend an empathetic ear. Simply knowing when someone is there for them and cares about them can make a world of difference. Your support can do wonders, and giving them compliments and appreciation is like embracing them with love. An embrace where all their worries go away and only comfort surrounds them. Don't forget to like, share, and subscribe for more mental health videos like this.